One of the most common questions people ask is about numbness in the fingers. Many want to understand why it happens and how it can be reduced or eliminated at home. Since this problem is widespread and does not have a single, universal cause, it is important to explain the possible reasons in detail. To understand this issue, it helps to know that the nerves responsible for sensation in the hands originate from the spine. In the lower part of the cervical spine, spinal nerve roots exit and provide innervation to the upper limbs. These nerves can be imagined as thin cables that branch out and reach each finger, passing through specific channels in the body. When compression occurs in any of these channels, numbness appears. It may happen while sitting or during sleep. Although the symptoms feel similar, the cause of compression can differ. In some people, the issue originates in the neck, while in others it occurs in the arm itself, even though the sensations are alike. Compression can occur at several levels. One of the primary areas is where the nerve exits the spine. In the cervical region, compression may result from disc protrusions, herniations, vertebral misalignment, or excessive muscle tension. In such cases, numbness acts as a warning signal. Sensitivity can be checked at home by gently testing the skin between the fingers. Reduced sensation, tingling, or discomfort may indicate nerve compression. For simplicity, the hand can be divided into zones related to different nerves. If sensitivity is reduced, gently stretching the neck upward and then rechecking sensation can be helpful. If feeling improves, this suggests that the problem originates in the cervical spine. Gentle traction improves nerve conduction and restores innervation. In such cases, regular neck stretching exercises can be beneficial.
Another common cause is compression of the neurovascular bundle in the area of the scaling muscles. This often occurs in people who spend long periods sitting at a desk, driving, or looking down at a phone with the head pushed forward. In this posture, the muscles become tense and compress the nerves leading to the arms, resulting in numbness. Changing posture and relaxing these muscles may temporarily relieve symptoms. Sensitivity is checked in the same way as before. To reduce tension, the elbow can be supported, the shoulder slightly lifted, and the head gently tilted while massaging the tight muscles. This is followed by stretching in the opposite direction. A mild pulling sensation along the side of the neck is normal. These movements help restore blood flow and nerve sensitivity. If improvement occurs, strengthening the neck muscles and maintaining proper posture becomes essential. Another possible site of compression is the axillary channel. Important blood vessels and the brachial plexus pass through this area. If working on the neck and scaling muscles does not restore sensation, attention should be directed here. Gentle massage of the surrounding muscles, followed by stretching against a wall or doorway, can help. During stretching, a pulling sensation may be felt in the shoulder and chest area. Sensation should then be reassessed.
If sensitivity improves, it indicates the need to strengthen the muscles that stabilize the shoulders and regularly stretch the chest muscles. This helps restore proper nerve supply to the fingers. Another frequent source of numbness is compression of the ulnar nerve. This commonly occurs in people who spend long periods with their elbows bent, whether sitting, lying down, or using a phone. Prolonged bending disrupts the natural pathway of the nerve and restricts blood flow, causing numbness in specific fingers. Stretching the arm into a straight position often produces a pulling sensation around the elbow. After stretching, sensation should be checked again. If sensitivity returns, it is important to avoid keeping the elbows bent for extended periods and to keep the arms straighter during daily activities, especially when using electronic devices. The final key area is the carpal tunnel at the wrist. Several nerves converge here and extend into the fingers. Problems in this area are common among people who frequently use their hands, such as artists, office workers, and programmers. Improper wrist position, especially when using a computer mouse, can cause compression. Stretching the wrist helps relieve pressure. A warming sensation often appears, followed by gradual restoration of finger sensitivity. By systematically checking each of these areas, it is possible to identify the source of nerve compression independently. In many cases, this approach allows people to avoid invasive procedures and focus on the exact problem area. In more advanced cases where swelling and multiple compressions are present, all channels may need to be addressed.
Regular self-assessment, attention to body signals, and consistent stretching exercises help restore nerve function, improve tissue nutrition, and maintain overall hand health.